vessel uh, appears to have a communication here. So probably this is the feeder vessel. So this is very important. So first step, a lot of water in the gastric fundus. So hello, good afternoon, and thank you so much for all our followers. We increased numbers of subscription to 700. For scientific purposes, this is a lot, and more specific for just for endoscopy. So that's very nice in our live endoscopy channel. So today I will show how to deal with gastric varices using endoscopic ultrasound guided coils plus cyanoacrylate injection. So I am here at the level of the cardia, and you can see here the gastric fundus here. This is a 70 years old man with history of alcoholic cirrhosis, and this is the gastric varices. This is a big gastric varices, huh? As you can see here, this is a 3 centimeters gastric varices. It's a big vessel. Calculate injection that continues to be the gold standard technique is that we cannot see all these vessels, and probably when I will start to do my treatment with by the standard technique using endoscopy, just endoscopy, probably I will go here, or I will go here, or I will go here, and I will not be inside the vessel. It's one of the big limitations. So I think this kind of technique have very much power regarding the results to treat this kind of vessels. It's more sure first because I think it's brilliant the idea of Kenneth B. Muller and people from Europe to pass through the esophagus. You can see here, this is the esophagus muscle. So there are two techniques. So the first one is to go inside the vessel. The problem with this vessel is that we have a lot of vessels inside. So what is the vessel that I will go inside? And that's very important. So second, and is one of the important tips with the new technique regarding Eus-Guided vascular therapy is to follow the vessels. All these vessels will finish in one vessel or two vessels sometimes. It will depend. So if I follow my vessels, I see this vessel that you see there, but if I turn, this will be communicate with this vessel. So probably, and to my opinion, this is the feeder vessel. It's not so difficult to search again. So I am looking all the vessels. You see a lot of vessels here, but all the vessels will finish in one vessel. To my opinion, probably also is that this patient have two vessels. First one, this one here, that I believe have a communication with this here. You see? So it makes a turn. You see? Here and comes here. So I will go and I will target this vessel first. Why? First is a big vessel, big diameter. We have 1.18 centimeters. So this will give me easier access inside the vessel. Second, I will flush to see with saline solution if the distribution of the saline solution goes in all the vessels. And third, I will use variceolography, as we already published in digestive endoscopy. So I invite you to read our paper about variceolography and to target the feeder vessel. And why to target the feeder vessel? Because we can use less coils, and the distribution of the cyanocrylate injection will go in this direction and not coming from here to the opposite. So we will start our treatment. You need to be sure that you are in the correct vessel. You need to use water to see if you are in the gastric fundic area. So I will use a 19 gauge needle today. This is a spec needle, and I will try to put my US vision through the esophagus. So I'm here in a good position now, and I will ask to my nurse to pass the needle for me. So some of endoscopies already flush with water. I don't like to flush with water. I like to prefer to perform an aspiration of the vessel. You see, I am inside. So now I'm sure that I am inside the vessel. You see, there is blood. First, there is blood. Second, my tip of the needle is inside the vessel. Okay, now I will fix my needle here, and I will flush with saline solution. You see? You can see the distribution of the saline in most of these vessels. Again, dame nuevo. So I will flush again. I need that you see the distribution in all the vessels. So the distal vessels will be collapsed after putting my coal and my cyanocrylate injection. So now, necesito ver la fluoroscopía, por favor. So now I will confirm using variceolography. You see? Very nice, very nice. There is two vessels here. So you can see going down the left gastric vein, and two vessels appearing from the left gastric vein. Again, voy a usar de nuevo y después me pasas solución salina. So I will perform again. You see, there is one to the right and the left gastric vein going to the left also. So, but they are going to the same point. So now I will flush with saline solution. Perfect. Okay, voy a usar. So I will use a coil, big coil, because This is 11 millimeters vessel, so we try to use at least 120% more of the vessel. So I will use 16 millimeter coils. 1.16, por favor. So I will start to do my procedure putting the higher coil that I have, and then I will diminish the diameter to go inside the coil and to occlude completely. Ok, la imagen ecográfica, por favor. So I will use this coil, the Nestor coil from Cook Medical, uh, is less expensive than the MRI coil. So you can see. Podemos ver la imagen también de fluoroscopía, por favor, al mismo tiempo. So you can see the vessel. You see here. I am occluding the vessels, and you will not be worried if this coil is too bigger, because this will be adapted to the diameter of the vessel. So don't worry about that. Dame uno de 14, por favor. Now I will diminish my coil, because if you see here, there is the coil, but there is still flush inside. There is still blood passing, and I will show you using the power Doppler. You see? There is still flow. So I will use another coil. Varicelography will help me to see if there is some chance that sometimes we can see in some patients, and to try to avoid to use cyanoacrylate injection. So now I am putting my second coil. You see, no sé si podemos girar un poquito la fluoroscopía. Puedes cambiar la posición. Angúlalo hacia acá. No, no, no. Esto. Más. So you can see. Más, con ganas. Okay, you can see the vessel there. You can see the coils inside, but there is some space there. Okay, toma. Okay, listo. Vuelvo a la posición normal. And I will use another coil now. Dame uno de 12. So now we see again the flow. And I will see so here there is a still flow, but it's less flow. Otro más. ¿Este cuánto es? So I will use a 12 millimeter coil. retira. So first, using US guide, I am sure that I am inside the vessel. I can follow and I can find the feeder vessel, and probably my target will be better. Empuja, por favor. Ok, retiro. Vamos a usar 11 ampollas. So now I will put the cyanoacrylate injection. If I go more distal, I can see that there is a still flow, but this will diminish. In a few minutes you will see that. You see, the distal part doesn't have Doppler. Okay, let's go to see. I will use 3 ml of 2-octyl cyanoacrylate injection now. Primero necesito solución salina. So I will flush with saline solution. Ten aquí. Necesito más salina. Dame. ¿Ya tienes las ampollas? No, hay nomás. Tenlas ahí. Para allá. The first results of this technique is that it showed that diminish the risk of rebleeding as well. Ayúdame. Okay, now was okay. And now I will flush again. I pass the cyanoacrylate injection and I push with saline now. So now I will push the flu and I will measure with the Doppler, and you can see I don't see more flu. Even if I put the Doppler, there's not signal. So now I'm sure that this patient is already treated. I wait. Okay, there are some vessels here, and probably it's coming for the second area, the second vessel, because there are 2 vessels being as a feeder vessel. So there is important to evaluate. You see, we will see now. But I believe that this with this one was okay, huh? I don't see flu. Huh? There are some flu here. So probably was not enough. We need to treat the second vessel, and I will treat this vessel now. There is a second vessel. There is a second vessel. Okay, we will treat this vessel now. This one. Okay. That's why it's very important to see the varicellography. This will help you to distinguish if you need to have to treat the second feeder vessel. There are two feeder vessels, and we treat one of them. So now we'll use another one. No quiero otra. In this case, I will use another needle. This part is already treated. Just this part that we need to treat now. Okay, let's go to C. Okay, I'm inside the vessel. You see? Again. Blood. And I will flush. You see the distribution of the saline? So it's going to the other vessels. Otra vez. You see? Perfect. So now this is, I am in the second vessel. Quiero ver la imagen fluoroscópica. So you see? I am in another part, in the second vessel, the second feeder vessel. Okay, dame coil. 1.16, por favor. Contraste. You see? Perfect. So there are two vessels. That's the big problem. Sometimes we can see that. No, dame contraste, por favor. ¿Me puedes poner la imagen de la fluoroscopía? That's why varicellography is very important. Look my position, and again, I will. Oh, you see? It's coming from the second vessel. So the first vessel is already treated, the feeder vessel, but this is the second vessel. So this is saline solution now. Ok, ponme la imagen ahora ecográfica, por favor. Hay de 20, porque este vaso es grande. Sí. Sí, dame una de 20. Gracias. So I will use a 20 millimeter coil now. So don't be worried regarding the diameter of the coil because the coil will be adapted inside the vessel. Remember that all vessels have a muscular layer, so it's very difficult to go outside with the coil. You see? Now I am putting a second empuja in the second feeder vessel a coil. Ok, dame uno de 14 ahora. Because I want just to occlude the whole vessel. So I will use one more coil. Este es de 14, ¿no? 14 to be inside the first coil. Okay. So remember, this was a 3 centimeter gastric varice. And this is uh, I think the most important aspect of the varicelography. I am going inside the vessel, you see? Empuja. And I am occluding the second feeder vessel. Retira, retira, empuja, empuja. Sometimes could be hard to push inside the vessel. Puedes empujar. Retira y pasarle solución salina. When it becomes hard, you can need to flush with saline and then to push again. Okay. Empuja. 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 Sigue. Ahí sigue. I will try to change my position. Now you advance. Sometimes you need just to change the position. Sigue. Sigue. No. Es mejor avanzar. Estás ahí. Retira un poquito si quieres, pero no mucho. Ok, ahí nomás. Empuja. Sigue. Se avanza. Empuja. Empuja. Let me see. Falta solo un poquito, ¿eh? So I will try to retie a little bit my needle. Just to give more space. Dale. Okay, avanza. Sometimes that the angulation, the pressures, but don't worry. Un poquito más. Empuja. Empuja. Okay. I will change my position again. It's the position. Okay. I am changing my position on my scope, and I am continue to advance. Vale. Okay, sigue. Okay, retira. Retira. Retira, sí. Vamos a ponerle más. I will flush again. I think it's finished, huh? It's a little bit. No, todavía no. No salió todo. Sí. Okay. Okay, dale. It's just sometimes the coil could be dislocated, but just putting saline, it will be enough. Perfect. Now was perfect. Now we finish. Very good. The problem is that my nurse didn't take the lunch today. So now I will put more glue. Dame 7 ampollas. So I will put 2 ml more of glue. Remember that this was a big vessel. And I will continue here, you see? This is a very interesting case. I had some cases with 2 feeder vessels, and it's very important to evaluate that using US. That's why it's very difficult when you do just with the standard EGD. You don't have any idea if you have one or two feeder vessels or if there is a shunt. So I think it's more complete technique, and the results worldwide is becoming very interesting. No me gustan estas ampollas, me gustan las jeringuillas pequeñas, porque si no, no tengo fuerza. Okay, so you see the glue going inside. Now I am putting water just to flush. And you see going the glue in the whole vessels. Now, no more vessels here. No more Doppler, no more nothing. So I will use power Doppler now, and there is not more flow. And there were two vessels as feeder vessels, and I treat both during the same procedure. So now I will sorry. Now I will retire my scope, and I will use a standard gastroscope. ¿Me puedes mostrar la imagen endoscópica, por favor? La imagen del endoscopio, por favor. No tengo imagen endoscópica. ¿Tenemos imagen endoscópica o no? Por aquí entré. This was my access from the esophagus. You see here. Perfect. No more Varices. I'm sorry. I need to show you that. But my assistant didn't make it correct. I swear to you, it was a big vessel. There's no vessel. Puedes sacarme al aire con la del ecógrafo. Necesito salir para mostrar la imagen endoscópica. ¿Ya estamos con imagen endoscópica o no? So just to summarize regarding US-guided vascular therapy. So first, it is very important to define If there is one, two, or three feeder vessels, sometimes we can have three feeder vessels or two feeder vessels. That is the most important. There is a recently publication from the São Paulo group. My good friend from Dr. Demora and Dr. I don't remember his name. So they show it that there is no difference when you compare standard technique with the US technique. What I see from this paper, just as a comment, is first that they put the coil inside the gastric varices and they didn't put inside the feeder vessel. Second, they just put one coil and was not enough. So this is my comments regarding this technique that they use it, and they didn't find any difference, but we find a lot of difference. So I will show you the standard endoscopic view now. So this is my access port. You see the red point here. This was transesophageal, and now I will do my retrovision, and this was a very big vessel. You see this vessel by US, and I can show you the picture, but there is not more. This is disappearing. Look. Because I treat correctly this vessel, and this will disappear, and during the follow-up that we see in our patients, there is not necessity when you perform the combined therapy, at least in 2-3 years. So this is a fantastic technique. I think it's a promising technique. We are trying to publish now our full paper regarding the combined technique versus the coil alone and using the varicelography. So look, no more varices. It's incredible. This is magic, like Doctor Strange, huh? There was a 3 centimeter vessel, and there is not bleeding. No more bleeding. No more risk for this patient. So I will cut my transmission. I finish. This is a very nice explanation, very nice case today, because it was two feeder vessels, and varicelography showed to us that there was two feeder vessel. And the most important is that already I saw that also with Doppler. That was our first discussion at the beginning. So it's very important to use the technology and for treat this kind of pathological problems in cirrhotic patients or portal hypertension. So thank you so much for attention. Cortamos la transmisión, gracias.